I am Rebecca Conaway. I am a family nurse practitioner with Valley Health at the Pea Ridge location. I specialize in women's health, and I am here today to talk to you about breast cancer awareness. In the U.S., on average, 300,000 new cases of breast cancer will be diagnosed yearly. Worldwide, it is 2.3 million new cases of breast cancer yearly. In men in the U.S., it is approximately 2,500 new cases yearly. So comparison from women to men, women 300,000 new cases, men 2,500 new cases a year. The most at-risk groups for breast cancer are definitely women who are aging and postmenopausal. The average age for breast cancer is 62 years old, and they estimate that by the time women are 80, we have a 1 in 8 chance of developing breast cancer in our lifetime. Also, people who are positive for genetic mutations such as BRCA1 and 2 are in a much higher risk category than the average population. Traditionally, in the U.S., we start mammogram screenings at the age of 40. Now, is that the right indicator for everybody? Absolutely not. Like every other part of healthcare, we have to individualize. We have to take in consideration family history, personal history, health habits, and risks, and make a plan for that patient in particularly. Mammograms were intended to read fatty tissue of the breast that is found in postmenopausal women. So I often have young women who come into the office asking for a mammogram, and what I tell patients is often the mammogram will give them a false sense of security. Younger women with dense breast often are found to have normal mammograms. So having this dialogue, beginning to discuss risk factors, and talking about what screening tools would be best for patients is very important. I have a lot of patients who get very stressed with self-breast exam. And what I often share with them is, I just want you to feel. You're feeling for something hard. You're feeling for a BB, a marble, an M&M. You're looking for a change in tissue, a change in nipples. You're looking for something different. However, learning to start self-breast exam at an early age, I often talk to my younger patients when they start puberty and periods. It's a good time to educate them on self-breast exam. And again, individual risk factors may adjust our schedule and screening. The most important thing that we can do to support our breast health is be healthy people overall. Keeping ourselves active, eating healthy foods, trying to avoid as many artificial ingredients as possible, keeping your BMI at a healthy level, and making sure that you are living your life the healthiest that you can. Avoiding nicotine, avoiding smoking, avoiding alcohol, those are things that all of us can do to help decrease our risk factors. Everybody needs regular screenings and workups. We now know with BRCA1 and 2, which are the 2 genetic mutations that we have identified that are associated with not just an increased risk for breast cancer, but an 80% increased risk of breast cancer. Those are only 5 to 10% of the breast cancer patients that are diagnosed on a yearly basis, which means 90 to 95% of new breast cancer patients do not have genetic mutations for breast cancer. We have been raised in society to believe that we are being healthy to prevent disease. But in all actuality, disease affects everybody, not just unhealthy people, but healthy people as well. And the reason we want to be healthy is less about preventing cancer and more about surviving cancer. Healthy people have better outcomes. If you go into cancer being a healthy person who is fit, who does not have chronic medical illnesses, who does not smoke, and who takes care of their body, they are more likely to have a better outcome at the end of treatment than somebody who goes into breast cancer unhealthy. So living our lives to be as proactive as possible and making sure that we are doing everything to cover all bases with our health is the most important thing that we can all do.